these pathways?
Um,
Or do you look them up?
I would have to look up the specific pathways, except I know 2 and 5, factor 2 and factor 5 very well.
So where do you go to look for it?
Go on the internet. It's really easy.
Hippocrates.
Hippocrates, e-medicine.
Okay, I just want to make sure that there's a method, because this is half the information.
Right.
If a doctor needs to give medicine, they need to know where they can get the information.
Absolutely.
That what
Yeah.
pathway, what medicine.
Yeah, Hippocrates is an app that I recommend to everybody that when I go through a training session, because you want to put this on your phone, because it took me literally, I don't know how many days to come up with these 250 drugs in the pathways. And I was with this Harvard internist in Atlanta, a Harvard trained internist, and she said, oh, so-and-so is not on here. And I'm like, oh, what is it? I got to go back to the internet. And she's like, oh no, hold on. And she just pulls out her phone. She's like, oh look, it goes through 3A4. I'm like, what? Where'd you find that? And she's like, oh, it's Hippocrates. So on Hippocrates, which is one of the most commonly used apps for physicians, you can type in any drug and then go down to pharmacology and it'll tell you the pathway it goes through. Because I will tell you that 99.9% of the physicians don't know half the pathways that these drugs go through. And I'm being generous.
Yeah. I mean,
It's
but,
not, yeah.
right. But the other thing is also right now, because this is leading edge, and this is for the first adopters. Once this information gets out there, and 10 years down the line,
Right.
these things are going to be common.
Yeah.
Everyone's going to know
Right.
them. But only at this point in time,
Right.
as you're
We're
introducing
right at the
it,
bubble, right?
exactly,
Yeah.
introducing it, so you're going to have the physicians look it up,
Right.
that kind of thing, and look it up for them, and then present it to them. that
Exactly,
way.
that's the key.
But once that's done, and you show them where they can find the information, Hippocrates or any other
Right.
places,
Yeah.
it'll be
Yeah.
common knowledge and
Right,
easily
and it's,
used.
you can't really put the whole list of, like you did, all those,
Yeah.
I mean, you can give it to them,
Right.
but,
Well, and I talked to Dr. Tu about this prior to making the statement I always make, is that I strongly believe in 5 to 10 years from now, when you go to the hospital, everyone has a hospital chart and it says allergies on top. I think your metabolizer status will be there as well. Because when you go into the hospital, there's just a multitude of drugs that you're putting on already. And if the physicians have this information at their fingertips, it'd be the top of the chart, and it's just as simple as just having different, color coding, green, yellow, red, to slide in the different spaces for your metabolizer status in a chart. But I strongly think that we're about 5 to 10 years away from that being a reality and really impacting medicine. And Dr. Tu, Rob, I don't know what your
Well,
thought.
genetics is changing everything in medicine now. I mean, you go to a, oncology meeting now, and it used to be you talk about breast cancer, you talk about lung cancer, you talk about colon cancer, but now they talk about genetic pathways.
Yep.
And each drug goes to the pathway. So if you've got this genetic pathway, that's the drug you get, whether it's colon, lung, breast cancer, or whatever. So I think you're right. I think your pathways are going to be on everybody's chart.
So,
And you're right too, because nobody knows what they are now, and nobody knows what you're talking about. And it's going to be up to everybody to educate them.
So I just send my list of 250 drugs to AI Biotech, so we can have it on a fancy AI Biotech thing with the different pathways, and so they actually broke it down to beta blockers and antidepressants and things like that. So you have a lot of the commonly used drugs that are actually on the report, okay? And there's a company that I found out of Alabama, so for $15 you can actually send the report with their medication list, and they'll give a complete one-page report to the docs, because most of the docs don't want to take the extra time, to interpret all this stuff.
They don't have the time.
Yeah, and if you can get a PharmD overread, you have that available for you as well. So, and then don't worry about this last one. The food is here, so I don't want it to get cold. Do y'all want to serve yourself?
You want to take a 10-minute break and we'll just...
Yeah.
Okay.
Restrooms.
Restroom.